Please like and subscribe for more CNA tips and skills. Our CNA makes 2 mistakes during this skill. Watch close to see if you can spot them. Our skill on Peri-Care is about to begin in Supplies needed for this skill are wash basin, lukewarm water, 3 washcloths, 2 towels, bath soap, linen protector, disposable bag for soiled linen, trash liner for soiled trash, barrier for bedside table, and gloves. Always remember your indirect care and safety tips prior to beginning a skill. Knock, introduce yourself, wash your hands, identify the patient, provide privacy, and explain procedure before beginning.
Hello, good morning, Ms. Jones. My name is Sonia. I'm going to be your CNA for today, and I'm going to be performing Peri-Care on you today. Is that okay?
The CNA begins this procedure by providing privacy to her patient. Next, she is raising the patient's bed to be sure that the bed is at the most comfortable working position for her as she provides patient care. She tests the temperature of the water, and then she lowers the head of the bed to be sure that the patient is in a comfortable position during the procedure. Now the CNA is donning a pair of new gloves. Since she is about to uncover the patient for care, she explains the next step in the procedure. As the CNA places the linen protector under the patient, she communicates to the patient that she will first roll her to her right, and then she will roll her to her left. She then ensures that the linen protector is flat and wrinkle-free. She provides privacy to the exposed parts of the patient's body so that only the perineal area is exposed. The CNA exposes the perineal area, gets a clean washcloth, applies soap to the washcloth, dips the washcloth in water, and brings cloth to a nice lather. The CNA spreads the labia and begins to wash the peri area from front to back, being sure to use a clean area of the cloth with each stroke. The CNA then disposes of her soiled linen in the soiled linen receptacle. The CNA grabs a clean washcloth so that she may begin rinsing the peri area. She dips the washcloth in soap-free water, and the same steps are followed as before, front to back, clean area of the washcloth for each stroke. Once completed, the soiled linen goes in the soiled linen receptacle. When drying the perineal area, the same steps are to be followed. Start with a clean washcloth, front to back, new area of washcloth for each stroke. Soiled linen goes in the soiled linen receptacle. Now the CNA will cover the patient, dispose of the linen in the dirty linen receptacle, and remove her dirty gloves and dispose them in the soiled trash.
Okay, now I'm going to sanitize my hands because I'm changing my gloves.
The CNA informs the patient that she is donning a new pair of gloves and will soon begin cleaning the buttocks and the rectal area. She places the trash liner on the bed so it is easy for her to dispose of soiled items. The CNA again being sure to provide privacy to all exposed areas of the resident. The CNA, following the same steps as before, gets a new clean washcloth, applies soap and water, and brings washcloth to a rich lather. The CNA will now roll the patient to her side and expose her backside. The important thing to remember is front to back and using a clean area of the washcloth with each stroke. The CNA places the soiled linen in the soiled linen receptacle. The CNA prepares a new washcloth by dipping it into water so that she can rinse the buttocks and the rectal area. The CNA rolls the patient one last time so that she may dry the buttocks and the rectal area. The CNA doffs her gloves and places them in the trash liner, preparing the trash liner to dispose of it appropriately. The CNA repositions the patient, covers her up, makes sure she's comfortable, and places her call light within reach. The CNA lowers the patient's bed to the lowest position, makes sure that she is comfortable, and asks her if she needs anything else before she leaves the room. Always remember your indirect care and safety tips when ending a skill. Make sure the patient's call light is within reach, their bed is in a low position. Make sure they do not need anything else. Ask them for their preferences related to privacy. Wash your hands, remove soiled linen and trash, and place in the appropriate receptacles. Our CNA did great, but she made 2 mistakes. Did you spot them? That's correct. She forgot to remove the linen protector from the patient's bed, and she did not place a barrier under her clean supplies on the bedside table. Please like, subscribe, and follow us for more tips and skills.